goodness, thank you for clicking on another video of your daily dose of NCLEX. Today, I've got a special topic it's not that special, but I just got a student who asked me about supraventricular tachycardia and they were confused. What's the difference between supraventricular tachycardia and a tachycardia? And I was like, let me go ahead, turn my camera on and talk to you, not only to my students, but I want to teach you supraventricular tachycardia. There's a trick where people do not understand how they need to break down certain rhythms, right, when it comes to arrhythmias. But before we start, I want to give you my ebook for free. Just because you clicked on this video, this is the real NCLEX world versus NCLEX textbooks, ebooks. And oh my goodness, you know when my students go to the test center, after they get out, they text me the topics that they got on the real test. So what did I do? I took screenshots of those topics and I put them in one ebook, and I want to give you this for free. All you have to do is click the link below and download it, and it's amazing. All right, now let me grab my red marker. Let's jump into this topic, supraventricular tachycardia. So now you see this rhythm. Every time you want to break down a rhythm, you've got to understand, you've got to follow a certain algorithm. If you don't, then if you're an expert, that's fine. But if you're sitting for your NCLEX, my advice is you follow the algorithm, and once you follow it, bam, you're gonna get the answer right, all right? So what we're gonna do, we're gonna talk about rate, rhythm, P wave, and QRS. And we're gonna fill out the information here from the rhythm that we have. Now when it comes to rate, I want you to understand, before we start, this is not basic training, all right? So if you don't know basics of ECG, like how the strip is formed, like the 6-second strip, small boxes, big boxes, you know, what's a P wave, what's a T wave, what's a QRS, then you need to watch my basic training video when it comes to ECG, all right? Now, this is what we're gonna do, all right? We're gonna discuss the rate. Normal heart rate is 60 to 100, right? So 60 to 100 is a normal heart rate. Below 60, we call it bradycardia. Above 100, we call it tachycardia. All right, now we want to know what's the rate, what's the heart rate on this rhythm. So to calculate the rate, what you need to do, you need to count how many QRSs you have, right? So this is the QRS. It starts from here, boom, 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 until here, right? So this is a QRS. So now, what I'm gonna do, I'm gonna count R waves. So this QR. Right? So I'm gonna count how many R waves I have, right? So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17. So I've got 17 R waves. I multiply it by 10. Now the heart rate is 170 beats per minute. Now I want you to keep in mind that this strip from here to here is a 6-second strip, which is the standard, all right? So that's why we multiplied by 10. Now, if you have a 3-second strip, a 12-second strip, you cannot multiply by 10, right? So 6-second strip, it's 17 R waves multiplied by 10 now. The heart rate is 170. What do I call this? Is it a bradycardia or a tachycardia? Of course, this is a tachy, right? This is a tachycardia. Fast heart rate. Now the rhythm, what do I mean by rhythm? What I want to check if the distance between one R and another R, and then another R and another R, so distance between the R waves is the same, all right? So how do I check the distance? This is what I do. Actually, I use my eraser to draw this, right? But what you do, you grab a piece of paper, right? For example, let's say this. You grab a piece of paper, and then you mark the first wave, the first R wave, and then you mark the second. And then you check the distance. And that's what you do when you're really checking a real strip on your unit, all right? So now I want to check if it's regular or irregular. Now what I did, when I drew it, this is how I drew it. I put this, and I start putting points, moving it like that, putting another point, another, and then I drew it, right? So I already know that those are the same distance, right? So same distance, same distance, same distance, same distance. All of it, all the R's are same distance, right? So since the distance from R to R is the same between all R waves, now what do I call it? So the rhythm is regular. all right? So if the distance was not the same as in atrial fibrillation, if you have not watched my atrial fibrillation video, then you've got to go watch it because it gives you an understanding about ECG, right? So in atrial fibrillation, the rhythm is irregular, right? Because the R to R are not always the same distance. In this case, it's regular. Now P wave, I want to check P wave. P wave is the wave that comes before T, right? P wave is the rhythm that comes before QRS. So it should be here somewhere, right? Now you might think that this is a P wave, but this is actually a T wave. Not a P, it's a T wave. All right, this is a T wave right after the QRS. But here, the P waves are missing, right? And why they are missing? Because this rhythm is so fast, the P wave gets buried inside the T wave, right? So it is buried inside the T wave, so you don't see it, right? So P wave, not available. So it doesn't exist, you don't see it, right? Now it comes to QRS, what I want to know in terms of the QRS, is it a wide QRS or a narrow QRS? Now you need to understand basic ECG training when it comes to QRS. What's the normal? All right, 0.06 seconds to 0.1 seconds, right? So that's the normal. That's a narrow QRS. Now here, since we don't have small squares and we don't have large squares, you cannot measure the distance, but I'm telling you, this is my example, this is a narrow QRS, right? So a narrow QRS, right? So narrow QRS, usually like 0.06 is 1.5 small squares. And 0.06 is, 0.06 is 1.5. And 0.1 is actually 2.5 small squares, right? So if you look on an ECG strip, you're gonna see small squares, large squares, and the lines, so you just count them, all right? So now, when I have those criteria, right, it's 170, regular, and there's no P wave, and it's a narrow QRS. What do I call this? I call this supraventricular tachycardia. All right, if you have questions, hey, what's the difference? I'm going to tell you the one single difference, actually two single differences when it comes to what's the difference between supraventricular tachycardia and a regular tachycardia, which was the question that one of my students asked me today. If the heart rate, if the heart rate is below 150, right, then you've got to think about regular tachycardia. If it's below 150. Now in this case it's 170. But the other criteria you need to check for, not just the heart rate, but also the P wave, right? So if there's no P wave and the heart rate is above 150, then supraventricular tachycardia. Below 150 and there is a P wave, it's a regular tachycardia, right? That's how you can tell the difference. Now let's talk a little bit about management of supraventricular tachycardia. What do you need to do, all right? So first thing, if you got a patient and he tells you, oh, I've got palpitation, my heart is racing, the first thing you gotta do is you gotta put that patient on a monitor. And then you've gotta take, of course, the vital signs, but you also gotta take their oxygen saturation. If that patient requires oxygen, which means his SpO2 or peripheral oxygen saturation is below 95%. You've got to put that patient on oxygen. A lot of my students or a lot of people on the unit, they think, oh, I need an order for oxygen. I need to go, grab the provider and tell him, hey, my oxygen saturation is below 95%. What should I do? And then the physician will say, put him on nasal cannula 2 liters per minute. And then you go back to the room, you put... Can you imagine this? If you are the patient and you feel that you can't breathe, your oxygen is not sufficient enough in your body, and you check the oxygen saturation and it's 95%, are you going to wait for a doctor's order? No, right? You don't need an order for oxygen saturation. You just, for oxygen, you just hook the patient on oxygen and then secure an order within the next 24 hours, all right? So the next step, you've got to secure an IV line, all right? When you've got a patient on the unit, they've got an arrhythmia, you can see it on a monitor, you've got to put an IV in that patient, all right? So peripheral IV, in case the physician gives you orders, then boom, you got to get those orders, all right? Now, with patients who have tachycardia, usually their veins are tricky, right? So make sure you give yourself sufficient time to put that IV access so that when the physician orders adenosine, cordaron, whatever the case might be, or amidaron, or adenosine, whatever the case might be, then you have IV access, you can execute the order right away, all right? Now, let's talk about this for a second. Before you administer any drugs, what you need to do vagal stimulation. Now, we don't do carotid massage anymore. We talked about that in previous videos, but what you need to do, carotid massage, you don't do it anymore. I'm gonna just, spit it out there. Because sometimes there's clots in those carotids and you don't want to massage them and activate those clots, and then they travel all over the body as emboli, right? So we don't do that. It's not an approved practice by the AHA anymore. Now, when it comes to vagal stimulation, this is what you want to tell the patient. You want them to bear down as if they are defecating, all right? And sometimes it helps when you tell them to put their thumb in their mouth and blow on it, all right? What that happens, it increases the interthoracic pressure, and then that tachycardia might convert, all right? So we want to control the heart rate. If the heart rate was not controlled, what you need to do, you need to get a physician order, usually is a beta blocker or calcium channel blocker. Now, if you get the heart rate controlled or not, now you want to convert the rhythm. How do you convert the rhythm? Usually, the physician will order adenosine. That's the number one, or the drug of choice when it comes to supraventricular tachycardia. You start with 6 milligrams, you give it to the patient, usually in a central line. If not a central line, if you're giving it in a peripheral, you need to push 20 mLs of saline. Boom! Immediately, because the half-life of adenochore is so short, so you need to make sure that it hits the receptors in the heart as soon as you give it, right? So you give it, boom, you push 20 mLs of normal saline so that that adenochore will hit the circulation super fast, and then that would convert the rhythm, all right? Now, if the 6 milligrams did not work, what you need to do, you wait a couple minutes, didn't work, boom, you push another 12 milligrams. And if 12 milligrams didn't work, you push, boom, another 6 milligrams, all right? So that's the algorithm when it comes to adenochore. Now, some physicians also use cordaron, all right? So cordaron, you follow the same protocol that we talked about in atrial fibrillation. It is 150 milligram for the first 10 minutes, and then 450 milligram over 6 hours, all right? Love your face. I want to give you another gift. I've got another ebook. This is the 300 Spartan medication e-booklet. Remember when I told you when my students go to the test center, after they get out of the test center, they text me not only the topics, but they also text me the drugs that they got on the real NCLEX. What did we do? Me and my colleague, Professor Aileen Burke. Oh my goodness, if you don't know Professor Aileen Burke, look her up. Google her right now. She's a nationwide, well-known NCLEX copywriter. She's been writing for all those big brands, Kaplan, Lippincott, Le Charity. Dude, she's 60 years old, so she's been around for a minute, and she started working with us in the last 2 years. And oh my goodness, we built a Q-Bank with new generation NCLEX questions for 2022. It's gonna blow your mind away, but that's a different topic. I want to give you this for free. So we worked on those 300 drugs and we put them in one ebook, and we categorize them as per families. You've got the name of the drug, indication, side effects, and patient teaching, which is all you need to know when it comes to the NCLEX. This is amazing. If you master this ebook, then you will never ever get a question wrong. Remember, tag me on your stories at Alpha Slice. Also follow me on Instagram, Alpha Slice and NCLEX Q-Bank. If you didn't subscribe to my channel, please do. Leave a comment below. Share this on your Facebook. And one more thing. I want to give you a gift. If you want to know what is the ultimate NCLEX algorithm that we use with our students to pass on their very next attempt, I'm inviting you to a free webinar. All you have to do is text the number that you see in the description box or on the screen. Love your face and can't wait to see you in the next video of the Daily Dose of NCLEX.
Hey Mo, hey Alpha Slice. My name is Abdurrahman Ayash. First of all, I want to say if I can do it, you can do it. I did took the NCLEX exam 2 times before and I did fail. Finally, I did took the NCLEX exam last week, and guess what? I did pass. So I wanna just give a few hints about like why you preparing to your NCLEX exam. First of all, you have to trust your teacher and trust yourself. Trust your teacher. They are provide you the good material, good content, so you can pass your very next attempt in your NCLEX exam. And the way how they present like all these questions or like these weak point, or like be like all the student they miss like many questions, not because they don't know the answer, but like the strategy they doing it is wrong. And this is one of like my big issue, which is SATA question. Even in my last exam, I do have more than half of the exam all SATA question, and this is one of my weak point, which is really like I did like work on that. Another thing, trust yourself. You're not like loser, even if you did took and failed many times, still like you can do it. Just like know how you study, know your content. When I mean like know your content, like master your content, you have to master it. So at the exam you will not like be surprised for any question, even if you don't know like many question on the NCLEX. Sometimes I don't hear like many terms or many medication or whatever, but you can use the strategies like assessment or ABCs. This is gonna help you. Second thing, visualizing is very important. Like when you start preparing, visualize yourself with all this, like even it took you like 1 month, 2 months, 3 months. Visualize yourself like you're studying hard. There is no many like social with your family, friend, even like your habit. Just like visualize all this stress. And then visualize also yourself while you're taking the exam, and then look when you submit and your examination to know if you pass or failed, and for sure you can pass. And look for the pass things, not the fail. I want to talk about challenges. Everyone has challenges in his life. So for me, my mom, before even I start prepare for this, before like 4 or 5 months ago, my mom, she passed away, and I do have another 2 family member also, they passed away from COVID. So it's like really tough situation, and I did surgery, and I do have like some stress situation while I'm studying also on, or like preparing for the NCLEX. So just like when you go to study, just turn off everything around you and just focus, because you want success. Look for that thing, and I hope you will pass for the next very attempt for your NCLEX. And don't forget, if I can do it, you can do it. Love your face. Thank you.